In Washington state, fears of a new outbreak at a care home in a Seattle suburb. It's not far from the hospital where the US recorded its first coronavirus fatality. As that country's military was brought in to help with the disinfection in the southern city of Daegu, authorities advised South Koreans to stay at home over the weekend. Many churches have scaled back services, moving sermons online. In Italy, Europe's worst affected country, frustration is growing in northern towns under lockdown. Travel in and out is limited and schools and businesses remain closed. Give us back our freedom, residents here demanded. Their town has been locked down for more than a week.
The first few days, there was perhaps a little more tension in the town because people were understandably a little scared. But now the news has faded and people are getting increasingly frustrated. Now the fear of what will happen next here has overtaken the fear of the virus.
Even in the nearby city of Milan, not under lockdown, residents are worried about the economic impact of the coronavirus. Usually packed with tourists, this weekend the city was relatively deserted. Italians are hoping the outbreak will be curbed quickly, so they can get back to business as usual.
For more, we welcome Mohammed Munir. He's a viral infection and vaccine expert at Lancaster University in the UK. Mr. Munir, we're seeing the virus continue to spread further in many countries. Give us a little perspective. Was this largely expected, and is the worst yet to come?
Well, based on all scientific calculations and prediction, it is pretty clear that the virus has not reached to its peak. And this is especially important when we are now seeing a community spread, a spread between people without any known history or the contacts. That is worrying some. And also, because the disease has reached to thin economies in many developing countries where there is a leaky and a weaker healthcare system. So based on all of these clues, it is highly likely that the overall impact of this virus on public, on economy, and the environment will be large more in coming weeks.
Are there new insights on how the virus is transmitted, and why is it spreading so quickly?
Well, this virus has a few peculiar characteristics. The first one is really the reproductive rate. It has a very high reproductive rate, which means how many people can be infected from one sick person. So with the COVID-19 infected person, it has a capacity to infect at least 3 people in the vicinity, which is 3 times more than in seasonal flu, for example. Not only that, but this virus appears to be less lethal. So therefore, it has more tendency to spread between the people, between the communities. So based on these overall nature of this virus, it appears that it is spreading very lavishly, and it would spread at a broader scale if the control measures would not be put in place in all those vulnerable countries.
Whenever the public is hit with a new health crisis, they want to know, how do we fix this? What about the prospects of a vaccine? How close are we to actually getting an effective vaccine that can be used safely by the public?
Until we don't have vaccine or therapeutic available, the threat of this virus will always remain hanging on to the humanity because of the kind it's spreading, because of the overall perspective it is posing onto the globe. Making a vaccine is really a long process. Just to put it into the perspective, for example, the Ebola erupted in 2014, and the first vaccine that came into market was in late 2019, after 5 years of the outbreak. By that time, Ebola was not on the scene. So we are trying our best to make the vaccine available, mainly because of the information that was available from related coronavirus SARS back in 2002, 2003. So on a cautionary note, I would say that within 8 months to 1 year, we will have a very good vaccine that would become available for the public use. But until that, the only option we left with is the containment and the control measures to be adopted.
Mohammed Munir, really appreciate your time. Thanks so much.
Pleasure.